Hello, good morning, everybody. My name is Shannon Echeverry, and I'm the director of the Turner Senior Wellness Program. And we are here with Belle Churchill with Visiting Angels, and she's going to be talking to us today about 10 questions to ask your doctor. So, a couple housekeeping things before we get started. So, it should be at the bottom of your screen. There should be several buttons. There is a Q&A button. So please put in your questions during the presentation. Towards the end, Belle and I will go over some of these questions. And so you can make them anonymous or you can include your name as well. And also, there is an option if you want to show captions, there is a button for that. And just to let you know, since this is a webinar, we can see your comments in the Q&A, but we cannot see you or hear you. So please use the Q&A if there's any questions, if there's any concerns. You can also chat as well if there's anything that you'd like us to know. So this presentation is being recorded and I will email it out to everybody, or Nisha will, once we have it up on our website. So please help us by spreading the word with your friends and family, or if you just want to refer back to it. We would appreciate you helping spread the word in that way. We do have a couple of presentations coming up that just want to let you know about. If you're watching this live, we have on August 14th, Environments for Brain Health and Longevity. We have Dignity in the Silver Years on September 11th. And we do have various other programs as well. So please refer to the catalog, or you can always call us 734-998-9353 or email info.tswp@umich.edu. So I think those are all the kind of preamble that I have. I want to hand it over to Belle, and I hope everybody enjoys the presentation.
Awesome. Yes, thank you so much. Yeah, and thank you for having me. And I kind of have a little bit of a cough today, so if I have to grab a drink of water, put a cough drop in my mouth, I apologize. But yeah, so kind of as she said, my name is Belle, and I am the director for Visiting Angels here in Ann Arbor. I've been here for about 6 years now, and I'm really excited. So today we will talk about 10 questions to ask your doctor. So just kind of a little bit of an overview of what we'll be talking about today. So I'll kind of delve a little bit into visiting angels in general, who we are, how we can help. Then we'll kind of jump into questions to ask your doctor before you have a medical test, questions you should ask about your diagnosis. And then we'll jump into medications and finding out about the prescribed medications. And then last but not least, we'll kind of jump into questions regarding any prevention. So a little bit about us. So Visiting Angels is a non-medical private duty home care agency. So what does that all mean? So non-medical, so we are non-nursing or skilled services, but we can help with anything from companionship, meals, housekeeping, running errands, all the way up to total bedbound care if needed. So, those services could be just monitoring safety, having peace of mind that we're there, medication reminders, help with toileting, bathing, um, all the way up to, bedbound total care. We do also partner with a lot of hospice agencies in the area to provide some supplemental care for anyone who is on hospice. And we also do work a lot with individuals who have some sort of dementia diagnosis. So we're really passionate about that as well. Um, the private duty part, so it is that one-on-one care, can be in the home, in a facility, wherever, the client is. Usually that does mean it is out of pocket pay, but we do accept, long-term care insurance and also veterans benefits. We do work really closely with the VA, so that certified veteran provider, we are. And so anyone in the community who has served in the military and who meets the qualifications can receive up to 16 hours of free home care a week, which is really, really a great benefit. Really, all you need to do is just meet with your primary care provider, and then talk with someone in social work over at the VA. And if you meet their qualifications, usually it's you need help with one or two activities of daily living, then you can get qualified and start receiving those free home care benefits. And then kind of like I mentioned, we do help with companionship all the way up to 24 hands-on care and anything in between. A little bit, something that makes us different from other home care agencies, is we are open 24/7. So we do have a really great on-call team in place who takes the phone after hours and on weekends. So get voicemails or an answering service or anything like that. You can talk to someone any hour of the night. Um, and then we do also provide meet and greets. So for first shifts, we are always out there with the client and caregiver doing introductions, making sure everything goes smoothly. We do quarterly quality checks, so we try and see the client and caregiver at least once a quarter to update care plans, make sure, matches are still going well with client and caregiver and everything's going okay in the home. And then something else is we do not have any weekly minimums. Some companies in the area, most of them have about a 4-hour minimum per shift. Some even do like 20-hour weekly minimums, but we don't have any minimums at all. So you could do 1 hour a day, 1 hour a week, 1 hour a month, whatever you need. So that's just a little bit about Visiting Angels in general. So advocacy and how we can help. So these slides will contain just some general questions, follow-up questions that you should, always be asking yourself, your physicians, keeping in the back of your mind. They can be applied to any testing, diagnostic condition, or healthcare scenario. We really want you to be the advocate for your health and well-being. Here at Visiting Angels, we truly believe knowledge is power. Obviously I'm not a doctor or medical professional, but our company has assisted hundreds of clients at this point, to appointments, surgeries, PT, OT, and we do care for clients pre and post-op surgery or diagnosis. So we do have a lot of experience and passion for advocating for our clients and assisting them through their health journey. It's really important that our caregivers know these questions as well. So we really try and teach them this information too, because a lot of the times they're the ones assisting them to their appointments, taking notes, communicating back with us and their family members. So it's important that they have this information too. But we aren't always in the home though. So we really want to make sure that you guys have this information and then just the general questions to ask and keep in mind. So just some common testing we see in adults 60 and older. This obviously isn't all of them, but just kind of the main ones that we see and just some examples. A lot of blood pressure readings. So this can obviously fluctuate between low and high. We help with this a lot in the homes and help track it as well. So that is definitely one of them. The colorectal cancer screenings, usually an annual at least, sometimes can, be more, but we have driven quite a few clients to colonoscopies, taking them home. Mammograms, another, one that should be done pretty regularly. Hearing test, cholesterol screenings, another one that can be low and high. We typically see more in the higher end in clients, but definitely screening to keep in check. Osteoporosis testing. So this one is really important, especially as you get older, bones become more fragile, and there's definitely a risk in, damaging, breaking bones, when falls are involved. So that one's definitely really important to get checked. And then UTI is one of the most prevalent and most common diagnoses and testings that we see. So, some questions regarding the medical testing. So, first and foremost, why is this test being done? So that's a really important question when going to the doctor. So has my blood pressure been high, low, for example? Is my balance off? Do I feel off in any way? Am I dizzy? Do I have shortness of breath, pain, confusion, appetite changes? What sort of symptoms am I experiencing, and why are you deciding to choose this test for me? So those are important things to keep in mind. Or is it just an annual screening that needs to be done? Next, this one's really important. What steps is the test involved, and how should I get ready? This one is really important so you know what you're walking into. Is it going to be a blood draw, a, a PET scan, MRI, DEXA? That is the osteoporosis screening is the DEXA. X-ray, CT, ultrasound, whatever it may be. Do I need to fast? So some tests require 12-hour fasting, some don't require any fasting. Drink water. Some require to drink 32 ounces of water. Are any dyes involved? So this one's really important because a lot of people can be allergic to dyes. So just important to know if they're going to be injecting you with anything for any of the tests that need to be done. And then making sure you have a ride set up. So you might not need a ride, but some tests do involve pain medications or even localized pain medications. And they won't even complete or perform the test if you don't have a ride and even someone just waiting there. So a lot of the times they'll tell you, you have to have a ride set up. They have to wait in the waiting room for you and then drive you home. So just important things to keep in mind and prepare for if you are getting any of these tests done. And then another really important question, are there any dangers or side effects to this? What can I expect? So am I going to feel any localized pain, fatigue, headaches, allergies to any of the pain medications or dyes that are being put in? Do any of these tests increase my risk of cancer? Another really important one. Will I, experience any nausea, upset stomach, things like that? So some additional medical testing questions. How am I going to find out the results? So, um, you've met with them, you've done the test. Now, how am I going to find out what's going on? And how long will it take to get these results? Another really important question. So just some examples, a blood draw can be within 24 hours or can take several weeks just depending on what they're looking for. MRIs, CTs, X-rays, PET scans, they can maybe take a little longer if a specialist needs to review the images, but they can also be done within 24 hours as well. An important question, are you going to call me? Tell me before I leave. Do I need to stay? Do I need to come back in for a follow-up appointment? A lot of things are online now. So they might have you sign up for an online portal. MyChart, for example, is a really popular one. And when you sign up, basically everything goes in there. So your after visit summaries, any results to any test go there directly. And then if there are any concerning readings or anything like that, usually the doctor will call and they might set up a follow-up appointment or things like that. If they do have you wait around, they also do a lot of printouts. So the printouts will have, information on what they found, what your diagnosis is, follow-up, things like that. And then what will we know after the test? So how am I going to know what's going on? So will I have to be on any specific medications? Do I need to make any lifestyle changes, diet, exercises? Do I need any more intense medical help needed? Follow-up appointments? Do I need to get any of those scheduled? Am I going to have to start PT, OT? Do I need home care to ensure, medications are being taken or that I'm getting to appointments on time? So these are all really important tests revolving around medical testing in general. Okay, so you've gone through the testing, you have your results, you've met with your doctor, you have an answer. Now it's time to delve into some questions regarding your diagnosis. So first and foremost, what may have caused this condition, and is it going to be permanent? So is it hereditary? Did something in my gene pool cause this? Was it my lifestyle? Was it diet, smoking, anything like that? Is it just in my environment? Was I exposed to something? Or is it just maybe the natural aging process? Can it improve with medication or therapy efforts? Or is this something I'm going to be dealing with for the rest of my life? How is this condition treated or managed? What will the long-term effects be on my life? So, some conditions can be easily managed with, daily medications, diet, lifestyle changes, things like that. Just basic increasing fluid intake. So this one's really important with UTIs, especially, to prevent those, to improve those, things like that. Can an aid help manage my meals, fluid intake, medication reminders? Absolutely. But there are also things you can do too as well. Will I have to undergo medical tests every so many months, weekly, yearly? What will the follow-ups look like? And then will the medication cause any confusion, balance issues? And those in general can lead to other health concerns that could impact long-term health. And then also just learning more about your condition, and becoming more educated on what you're dealing with. And kind of like I said, offices will print off a lot of literature for you. But there are also a lot of great support groups in the community. The internet. We obviously, live in a society now where we can get answers to questions within seconds. And the internet has a lot of information. Sometimes you just kind of have to be careful with what you're reading. So, always consult with medical professionals, I would say, before get the final answers there. And then also books, local library, whatever. They have a lot of great information as well. So questions regarding medications. So, visiting angels helps probably roughly 80% of our clients with medication management. It's such a huge one, that we help with and that we see in the community. So, um, why has this been prescribed to me? So really, it's based off your diagnosis a lot of the time, and what the preferred outcome should be. Um, how often and for how long you should take it. So this really depends. Could be weeks, months, years, could be morning with meals, evening before bed. Really just depends on the type of medicine you're taking, but a really good question to find out once it's prescribed. Medication reminders are going to be huge. If visiting angels isn't in the home, pill boxes, always get some pill boxes. And then a lot of our clients now are transitioning to technology. So a lot of our clients use Alexa, or like Google Home or things like that. And they can set digital reminders and it will set off an alarm to remind the client to take their medicine, which is really great. When will the medicine begin to work? So, this is a really important one to ask your doctor. When should I start noticing any results? Is it going to be normal if I don't see any changes in a week? Is it going to be normal if I don't see it within a month? So, something to definitely keep in mind when starting a new medication. And then another really important one, what are going to be side effects of this medication? Am I going to feel fatigued, nauseous, headaches? Is there going to be any localized pain, dizziness, appetite changes? What can you prepare for? Some other medication questions. What should I pay attention to when I get my medicine? So things you should look out for, which should be included when you get your medication from the pharmacy or even after you leave the doctor, is going to be dosage. So how many times a day am I taking this? Is it every day, twice a day, 4 times a day? When do I need to take it? Do I need to take it in the morning, afternoon, right before bed? With or without food? That's a big one. And also another really big one is this going to interfere with any other medications I am taking? What should I do if I miss a dose? This is also is a really, really big one. It's one we actually see quite often and is actually a lot of the reasons we are introduced into the home. It's actually a top 3 reason for hospitalizations in older adults behind falls. Um, so it really truly just depends. Sometimes you can take it as soon as you remember. Other times you should wait until the next dose. but absolutely consult your doctor and ask beforehand, if I happen to miss taking it in the morning, what should I do? Should I wait until the next morning? Can I take it as soon as I remember? This is where the pill boxes come in handy. And kind of like I mentioned, should I take it at meals, in between meals? Do I need to drink a whole glass of water with it? What times of day should I be taking it? Things like that. All really extremely important questions to keep in mind. Ask and confirm before starting a new medication. And like I said, medication mismanagement is one of the top causes of hospitalization in older adults behind falls. So something to really pay attention to when talking with your doctor. So next is prevention. So that's kind of the big one. So is there any way to prevent a condition that runs in my family? Unfortunately, we can't change genes, but changes in your lifestyle, diet seems to always come back to those that healthy living environment can definitely decrease the risk. Frequent screenings, so those annual screenings, visits to your doctor, advocating for your health and well-being, knowing the right questions to ask, can help with early diagnosis. And then, are there ways to keep my condition from getting worse? Again, that constant medication management, not skipping your meds, attending all of your follow-up appointments, asking the right questions, keeping a healthy and consistent diet, can definitely help your condition from, progressing quickly, getting worse if it is something you'll be dealing with, and just kind of keep it in check. And how will making a change in my habits help me? So obviously a healthier diet, exercise can help lower that cholesterol, blood pressure, blood sugar levels, heart healthy. That's really the important thing. And then are there any risks to making these changes? So absolutely consult your doctor before making drastic changes. Make sure if you are noticing any weird side effects, you're definitely letting someone know as soon as possible. And then some support groups in the community. So here are some really great support groups or just general community services. There's a lot of cancer support groups in the area. I know the Alzheimer's Association has a lot of great resources as well, as long as your resource center. The American Society on Aging has a lot of great information. Some of those community or care services, so like Visiting Angels, for example, to offer some extra support and peace of mind in the home. Also online, local physician's office, which where you can find a lot of great information on support groups and community resources as well. Yeah, and then so to if anyone is interested, we do have workbooks. It's called Talking with Your Doctor, and just contains some really great information anywhere from choosing a doctor and how you should go about choosing a doctor, learning about what should consider, getting ready for your appointment. So information you should take with you, your health history, health insurance, things like that. If you have any, POAs, anything like that, definitely take, but it has some really great information on how you should prepare for your first appointment. Also some further questions you could ask. Having a plan, be prepared, make a list of any questions that you have, list of any, medications you're taking, medical history, giving your information, what are your symptoms, being honest, being clear on what you're looking for from your doctor as well. But just has some really great information in here. And then it also has a lot of, again, great resources in here. I'm happy to drop some off. And then also in here contains some worksheets. So just kind of help get in the habit of tracking things. So there's a family history worksheet, questions to ask your doctor, kind of what we reviewed here, and things to keep in mind, changes to discuss and document. So a lot of the times, doctors, if you have any questions or notice any declines, doctors will ask for a diary or logs for any major changes. So when are you noticing these changes? Is it after you eat certain food? Is it certain times of day? Have you had any recent hospitalizations, bone, joint pains, shortness of breath? When are they happening? How many times of day? Have you noticed any skin changes? Things like that. So those worksheets are in here. Um, any general concerns, medication lists, things like that, is all in here. So if anyone's interested, we do have those as well. Oh, so sorry.
Thank you. I appreciate it. So the question in the Q&A was about getting the workbook. So I'm going to work with Belle to get some copies sent to the Turner Senior Resource Center. And then people can pick them up, or if you want us to mail you one, we would be happy to do that. So feel free to, if we don't have them by the time that the video goes out, you will have Nisha or I's email, and you can ask us when we have them. But we'll try to get those as soon as we can to distribute to those that could benefit from them. So if anyone else has any questions, it sounds like most of the questions are having to do with those workbooks that I think will be very helpful for people to have something tangible and as a reminder. Belle, can you speak to one thing that I see a lot is the importance of people having, if they can, to have someone with them for their appointments. Is that something
Yeah.
that you see in terms of, I'm just thinking about, how people, they may not be able to process the information if they're there by themselves, or they may miss information. Can you speak to that a little bit?
Yeah, absolutely. And it's actually something that our caregivers do a lot. A lot of the times especially if like family members are out of town or something, but a lot of the times definitely bring, so sorry, a proxy with you or something. If you can't afford home service or something like that, that's totally fine. But absolutely bring family member, friend, anything like that with you. Take notes, and make sure they're well versed in questions that they should be asking too. So that's why we try and educate our caregivers on this as well, especially if they're going to be attending a lot of the appointments with them. But they can ask the questions, they can take the notes, they can get all the information that's needed. For
Thank you.
sure.
What about, I know that you touched on kind of in general, the various questions that people need to ask, and you
Mhm.
highlighted some that come up most often. Um, are there a couple things that really stand out to you? Like if people need to take away the most important couple questions from your experience, what you would recommend or what you see?
Yeah, I would say if anything, the medicine section, it's just such a huge one that we see a lot. And it can, I think, impact your health the most out of this whole presentation. So, medication mismanagement, like I mentioned, is one of the top three hospitalization reasons for older adults. So asking the right questions on, that dosage, when they need to be taken. If I miss it, what happens? What should I do? That's a really big one. Especially if, you don't have someone in the home all the time reminding you. We see that a lot. So just knowing what to do, when to take it, having those pill boxes in place or someone in place to remind you to take it and things like that. But I would definitely say the medication section is probably one of the most important sections to ask questions on for your doctor and get all the information, the side effects. Is it going to interfere with any other medications I'm taking? Do I have any allergies to anything in these medications? Things like that.
Thank you. Good points.
Yeah.
One thing I do want to mention, because obviously, patient portals and virtual appointments, all of that has kind of changed the landscape of healthcare.
Yeah.
For those who are U of M patients, the Turner Senior Wellness Program, we are going to be having a couple U of M patient portal classes coming up. So we
Nice.
have one on Thursday, August 15th from 2 to 3:30, and Thursday, October 10th from
Mhm.
10 to 11:30. So someone from U of M Health is going to be here to talk about how to use the portal, how to sign up for it, how to access. Because I imagine that that's another piece too, is that now we just have access to more information, and trying
Hmm.
to interpret that can be difficult, because
Yeah.
sometimes it is, well, not sometimes, a lot of times it's very unclear that you have all
Hmm.
these test results, but what does that actually mean?
What does it mean?
What do
Exactly.
you do with that
Yes.
information? So it's good
Yes.
information to have, but I think that sometimes takes another level of trying to decipher what is important and what we should know
Absolutely.
for those of
Yeah.
us that don't have a medical background.
Yeah. Yeah, exactly.
Yeah.
Yeah.
So does anyone else have any other questions? Does one person has a question, does Visiting Angels do any kind of light housekeeping as a part
Yeah.
of your services? And is there, and I don't know if someone had a question about fees, if that's something, if they
Okay.
should reach out directly to you, or if there's something kind of standard that you can share.
Yeah, absolutely. Yeah, I don't mind at all. And it's on our website too. So, but yeah, we absolutely do housekeeping. So we do light housekeeping. So, we have like a list of things we can do, but basically we just ask that our caregivers don't do any heavy lifting. So like moving furniture to like dust, climbing on ladders, um, things like that. So, but like, vacuuming, a lot of our clients need help just like sorting through, like organizing and like cleaning out the fridge, things like that, bathrooms, but just kind of the general light housekeeping we can totally help with. Um, our rates, so we found like our 3 hour is like a sweet spot for, consistency with schedule. So we encourage clients to choose at least 3 hours, but like I said, we can do a 1 hour shift, 2 hour shift. So our 1 hour shift is $75. Our 2 hour shift is $50 an hour. So it's $100 for the whole shift. Our 3 hour and beyond is $36 an hour. So a lot of our clients are in that $36 an hour range. And then I did mention we can go all the way up to 24-hour around the clock care, and that's $34 an hour.
Thank you.
Yeah.
Appreciate that. And someone else had a question, is the patient portal different from my chart in the U of M health system? No. So those are the same thing. Yep.
Mhm.
So those kind of terms are used interchangeably. Um, and just to add on, if technology, um, like so many of us, it seems like there's a new application and new technology every single day, so it's hard to keep up. But the Turner Senior Wellness Program also has a smartphone series that is going to be starting in September. We also have technology mentors if anybody needs any one-on-one assistance. And then, I mean, we also have, different medical, adjacent services as well, blood pressure checks and lots of things. But just wanted to
Yeah.
share that information since that does,
Yeah.
have to do with accessing your healthcare information, which is really important.
Yeah.
Um,
Absolutely.
so any other questions? I'm not seeing any others in the chat. I did put in the chat our registration for future programs. So if you haven't checked out some of our other offerings, I encourage people to do that. You're welcome to come here to the center. We have lots of resources, information for caregivers, for people aging, that includes information like Visiting Angels, but also other areas.
Mhm.
We also have a lot of information about various different health conditions. So we do have packets of, if you're looking about kind of a handout on diabetes or a handout on other different medical things, we have that as well. So that's always would be a good thing to reference before or after your doctor's appointments, and that
Mhm.
may be a springboard as well for you to ask
Mhm.
questions for your doctor. So we have
Yeah.
resources available for that as well if folks are interested.
Yeah, absolutely. Yeah, and I'll get some of these workbooks out to you guys because they really do have a lot of really great information in them. So,
Wonderful.
yeah.
Yeah, that's fantastic. All right,
Yeah,
let me just do one more check of the chat because there's been a
sure.
couple things kind of popping in. Um, yeah, someone just made a comment and said that this was very informative. So yes, we are happy to do
Okay.
it. Thank you, Belle,
Yeah.
again for your time, and thank you
Thank
everyone for
you.
joining us today. And if
Yes.
anyone has any future topics of things that you want to hear about, different, it could be related to a certain medical condition, it could be aging in place, it could really be anything that has to do with the health and wellness of older adults. Please let us know. Right now, our catalog goes until the end of December, but before you know it, we'll be planning for January. So if there's anything that really piques your interest, please feel free to reach out. So thank you,
Perfect.
everybody. Thank you again, Belle, and I hope
Thank
everyone
you.
has a wonderful last day of July and the rest of the summer.
Yes. Thank you guys so much. I appreciate it.
Take care.
All right.
Bye.
Bye.